Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Tuesday, July 28th, and this is my daily briefing. We've had 220 positive cumulative COVID-19 cases to date in Missoula County, with 8 new cases since yesterday. 217 of those cases were identified by testing, and 3 were epi-linked. We've had 163 recoveries and 1 death. And we currently have 4 non-county residents that are hospitalized in Missoula County. We have 56 active cases with more than 250 close contacts. Active cases and their known contacts are in quarantine and isolation, and we will continue to monitor and support them as needed. The state of Montana is reporting 3,475 cumulative COVID cases, which is up 94 cases from yesterday. There are now 1,320 active cases with 62 active hospitalizations across the state, and there have been 51 deaths related to COVID-19, which is 4 more lives lost to COVID since yesterday's report. Counties currently reporting more than 100 active cases include Yellowstone with nearly 500 active cases, Gallatin with 136 active cases, and Bighorn with 114 active cases. We continue seeing COVID on the rise across the state and in our counties. Continue masking up for safety, following local orders, and implementing those safe behaviors to help reduce the spread of COVID-19. It's shaping up to be another hot day today, so please remember to wear that face covering as needed when in public settings that require it. And carefully remove the face covering when it's not needed, giving yourself some more breathing room, helping to keep your face cool whenever you're in situations that do not require a face covering for safety. We've reported that we're seeing delayed test results from tests that were sent to one of the state lab's contracted partners. We've started seeing those results coming in, but unfortunately we could still continue waiting for many results to come through. This delay is not unique to Missoula County, but is rather something that's being experienced by many counties across Montana. Our patient services staff have done their best to connect with all the patients tested at our health department county testing clinic, providing those patients with status updates regarding their results. This means that patients have been and will continue being updated so that they know if their results were positive or negative, or if their results are still in that holding pattern. If we're still waiting for those results, patient services let people know what is required of them for health and safety until those results come back. Our most recent data indicates that we're waiting for results from July 9th and July 10th, July 13th through the 17th, and July 20th. We're waiting on 24 results from the 9th, 10th, and 13th together, and more than a couple hundred from the remaining dates between July 14th to the 22nd. We believe the lab issues are starting to get worked out, and we did receive some results from tests that were done in the latter part of last week. So we hope that once we get through the backlog, we'll be getting back to getting those test results within 72 hours. So we will try to keep you posted on that as we move forward. I know that the testing process isn't a cakewalk for everyone. Going to the doctor is rarely what I would call fun. It can be difficult to rally for an appointment and a test and then have to wait for results, which can cause anxiety. This is why we continue maintaining ongoing, transparent communication about these processes, including information about delayed test results. We're also in the ongoing communication with the state and state lab, and we continue pushing for more timely results so that our community members can have ease of mind and can return to work if and when appropriate, and can better understand and see what COVID actually looks like in our community in real time. Since test results are delayed, the number of active cases reported in Missoula County at any given time is very likely an underestimate or underrepresentation of COVID in the county, since some people are receiving results up to and beyond 14 days after getting tested, meaning that they would have completed their full quarantine or isolation. That case data might not show up as an active case in our daily reports. It will be counted, however, under our total cumulative cases and new cases that are being reported to us. This is why we caution that the number of active cases reported is likely an underestimate. The case count data captures what we know when we get it from lab confirmed tests. We will not and do not report out the numbers of pending lab results with our lab confirmed active cases. We're sorry for the delay. We know it's terribly frustrating. It's really frustrating here too. Staff continue diligently working towards efficient and effective solutions. but some components of the COVID testing process really falls out of the scope of our control. In these instances, we want to keep communication open so that you know what we know, even if that means that it isn't necessarily new information that we have to share. So moving from one aspect of testing to another, I'd like to talk about our new county testing clinic and share some more specific details with you now that the lease is signed, operations have transitioned, and staff have compiled a soft opening or have completed a soft opening just yesterday afternoon. The fairgrounds served our needs really well for several months, and we're grateful for the space that helped us meet the county COVID-19 testing needs through spring and early summer. We knew that that space would not be our forever home. It was a great solution at the outset of our response efforts to efficiently respond to the urgent needs. We knew that we would need a space that would be viable during all of Montana's seasons, providing plenty of safe space with shade and cover from the sun and snow, for not only the patients getting tested, but for our public health staff that are supporting the effort on site and medical staff that are fully suited up in personal protective equipment, conducting testing one-on-one with the patients. We are in the process of fully closing down operations at the fairgrounds, and we're not seeing anyone at that site. We have fully transitioned to our new site at 4025 Flynn Lane. It is the old Garden City warehouse building. This new to us space lets us serve residents year round while continuing to maintain high safety standards for the staff and the public on site. The Flynn Lane facility has plenty of room for everything that we need there. There are office spaces for testing and operations staff, and there's a warehouse that we're using as our drive-through testing clinic during all seasons. We started seeing patients at that Flynn Lane site yesterday afternoon. We accepted morning calls for afternoon appointments, which has been our standard practice for testing appointments on Monday. For the remainder of the week and moving forward indefinitely, all county testing appointments will be at the Flynn Lane site. Our testing operations are up and running, and we'll be able to provide appointments and tests without any impacts to our current operations. While testing continues, so does the behind the scenes work. Remaining support and operations staff like our schedulers will transition out to the Flynn Lane site when we have all of our technology in place to support their work at that site. Know that the testing staff and the support that they need, as well as supplies, equipment, and PPE, are already at Flynn Lane, and we continue conducting tests by appointment only. So remaining support staff continue their work from their current workspaces in the health department building and remotely, and they'll be moving to Flynn Lane when the technology that they need to do their jobs is fully up and running. So we want to thank the Missoula County Fairgrounds for setting us out on the right foot. We look forward to serving Missoula County at 4025 Flynn Lane. That's just off West Broadway, and we'll be continuing to do our operations out there for the coming months. This move has not and will not impact the current testing operations, and we don't expect any lost testing days as we've already transitioned to the site and we're up and running with the testing. We continue offering testing services for Missoula County residents and frontline medical workers that are currently experiencing COVID symptoms and their close contacts that have been notified by the health department of their close contact status. Please note that if you are a close contact, you will be notified by us and you'll be told how to set up an appointment for testing. Sentinel testing, or the strategic testing of people working in high-risk environments that are not experiencing any symptoms, remains paused until the data indicates that our operations can withstand that expanded criteria. Flynn Lane site continues offering services by appointment only. Offering testing by appointment only is one of the many ways that we can ensure the safety on the site, as well as the efficient and economical use of our resources. So call 258-INFO and select option number 2 if you're experiencing symptoms or if you're a close contact to an active case. That's 258-INFO, option number 2 for a testing appointment. You can call 258-INFO and select option number 1 if you just have general questions about our COVID response. We do continue asking that you submit compliance comments directly to our Environmental Health Division and that you use our county feedback portal for general comments about our response. You can reach our Environmental Health Division at 258-4755, or you can email envhealth@missoulacounty.us. So that's it for my daily briefing today. As always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. Click that little notification bell so you get notified whenever additional videos are uploaded. You can call 258-INFO if you'd like to schedule a test or just get general information about our COVID-19 response. You can also follow us on Facebook at the Missoula City County Health Department Facebook page, and you can check out missoula.co/cvirus for lots of great information there. So until tomorrow, everyone, stay healthy.